So I did my Tech 3 assignment on a 4-week electronic health record training for new and novice nurses. I did this because during clinicals, each semester I have seen new grad nurses and nurses who have just transferred to that floor, started working. They have difficulties using the electronic health records and navigating their way through it, and it's costing them time with patients, and it's costing them time that they could be charting and documenting. So they're getting behind because they're trying to navigate and use the electronic health records effectively. So I made my clinical question. It was, do staff nurses who receive extensive 4-week electronic health record training over a 1-year trial effectively use the electronic health record compared to nurses who receive little to no training? So I found an article that talked about this, and the article is called Novice Nurse Preparedness to Effectively Use Electronic Health Records in Acute Care Settings, Critical Informatics Knowledge and Skill Gaps. That was the name of the research study. So this article, it talks about how they surveyed new and novice nurses, and they also surveyed nurse managers. And basically, what they found out from the surveys was that nurses are not getting enough electronic health record training. So they start out as a new nurse. First, when you start out, you're already overwhelmed. You're already stressed. You don't know where anything is really, and it can be put a lot of pressure on you. So the last thing you need is trying to spend all your time trying to navigate and find things in an electronic health record, or know what to document, or how to document it, or how to effectively use it. So they were saying basically that nursing schools can help out with this, with training. But overall, what I proposed was a 4-week electronic health record training program to focus solely on knowing how to use the records correctly. So what I did was I suggested that you hire a document/charting educator for electronic health record, and new and novice nurses will take this class's training program and focus solely on learning the electronic health records, navigating through it, practicing with like fake patients, and seeing how they're doing with their nurse educator. And overall, at the end of the 4-week period, the researchers will compare how well they can use the EHR, and how many less mistakes they make, and how less time they spend on it compared to other nurses on a different floor who are not doing the training program. So that was my research study. And one statistic I found in the research study that was pretty eye-opening to me, it was that more than 60% of nurse managers reported it took new and novice nurses more than 2 months to be comfortable using electronic health records. So it also was saying that these nurses who were orientating with other nurses, they have a lighter workload while they're orientating and trying to learn how to use the electronic health records. But I suggest just focused on using this electronic health record, since it's such a big technology that nurses will need throughout their whole career. They'll need to know how to navigate it, especially since technology is becoming such a big part of healthcare. So this is why I found it so important for this research study to be done. So if this can get nurses and nursing programs and different hospitals using this 4-week training, then it can overall effectively help nurses. It can decrease cost, decrease mistakes, and overall increase patient safety. So that is why I found this assignment and research study so important. And it was nice to be able to see this in clinicals and get the idea from being in a clinical setting, knowing that this can help. So thank you.